Vision is the single most important aspect of life. Without vision, life would be dark, without color. The beauty of the universe would be lost to us. Without vision, we would not create, nor would we ever know of our creations, our inventions. Indeed, the very meaning of life would be lost without vision. Loss of vision is the loss of a meaningful life. To perpetuate vision and to restore sight is our mandate at the Infiniti Eye Hospital. To preserve, to sustain, and when possible, to restore your sight remains our single most important task. This is what we do with compassion. We endow you with every care, so that you may continue to see better, see further, take in every joyful color of life. In this, we take great happiness, for the colors you see are the colors that light up our task. This is our reward, the happy colors of vision. The visionaries who have built Infiniti Eye Hospital are the eminent doctors Hitendra and Hijab Mehta. In preparation of their life's work, they have spent many years in the best institutes of the world, such as Sankara Netralaya and L.V. Prasad Eye Institute, perfecting their art. One of their primary mandates is to reach super specialty vision care to depressed sections of society. Dr. Hijab Mehta heads the Department of Cornea, Cataract and Refractive Surgery. She has conducted thousands of keratoplasties, phacoemulsifications and LASIK surgeries, and is experienced with cultured limbal stem cell transplants for ocular surface disorders, in addition to providing specialized treatment for keratoconus, known as corneal collagen cross-linking. Her department offers facilities such as slit lamp imaging system, immersion scanner, digital auto-refractometers, corneal topographers, pachymeter, corneal collagen cross-link system, with new treatment for keratoconus, phacoemulsification systems, LASIK and contact lens clinic.
Being the cornea surgeon, we see a lot of patients with challenging corneal or difficult, corneal cases, namely patients with corneal degenerations, dystrophies, patients with corneal infection, patients with corneal ulcers, and keratoconus patients. With the newer managing modalities and therapeutics available to us, we can now offer good treatment and timely treatment to our patients. We do a lot of corneal transplants at our center, popularly known as eye transplants. Initially, we used to do full thickness transplants. Now we are doing partial thickness or lamellar corneal transplants, where only the diseased portion of the cornea is changed. For example, if the inner layer of the cornea is affected, the inner layer is called the endothelium. We do only endothelial transplant, which is called as DSEK or Descemet stripping endothelial keratoplasty. If the problem is in the stroma of the cornea, we will change only the stroma, and that procedure is known as deep anterior lamellar keratoplasty. Then we are also doing what is known as corneal collagen cross-linking for keratoconus to arrest the progression of this disease. In addition, we also dispense specialty contact lenses to patients, especially keratoconus patients, because their vision is not good with the glasses.
The Department of Retina and Vitreous is headed by Dr. Hitendra Mehta.
I am Medical Director of Infiniti Eye Hospital and I specialize in vitreoretina. I have completed my vitreoretinal fellowship from Shankar Nethralaya, Chennai in 2002 and I practice exclusively only in the field of vitreoretina. We at Infiniti are equipped with the most latest advanced medical and surgical facilities for treating all sorts of vitreoretinal diseases like central retinal vein occlusion, branch retinal vein occlusion, diabetic retinopathy, surgical diseases like retinal detachment, vitreous hemorrhage, retinopathy of prematurity, macular holes, epiretinal membranes. On the diagnostic front, we are equipped with the fundus fluorescein angiography machine, the optical coherence tomography, and for the therapeutic modalities, we have a retinal green and red laser to treat all retinal diseases.
He has thousands of vitreoretinal surgeries to his credit and is one of the pioneers of sutureless vitreoretinal surgery in 2003. He offers treatments and technologies in fundus fluorescent angiography, ultrasound B-scan, green laser 532 nm, and advanced therapies such as photodynamic therapy, injections to arrest AMD, screening and laser therapy for retinopathy and prematurity, ROP, scleral buckling surgeries, and vitrectomy for stage 4 and stage 5 ROP, advanced surgeries for retinal detachments, diabetic vitreous hemorrhage, tractional retinal detachment, trauma, and endophthalmitis. All vitreoretinal surgeries are performed by the most advanced Constellation vitrectomy machine. It enables Dr. Mehta perform 25 gauge and 27 gauge vitrectomy, where the entire surgery is performed by making a 0.5 mm incision. He has a number of national and international publications and presentations to his credit and has contributed to chapters in textbooks. He practices vitreoretina exclusively for the last 16 years and performs all his vitreoretinal surgeries by the latest small gauge sutureless technique, which is the standard of care internationally.
One day I discovered that my left eye, I could hardly see from it. As a filmmaker, if you can't see with one eye, so I thought, my gosh, what is happening? Why am I losing my eyesight? What's happened to my eye? My lens, a lens has got many strings like a hammock, which is attached to the edge of your eye in many sides. And I realized, and he told me, that the strings on one side were actually dangling. Now, obviously, an eye operation is obviously an extremely scary thing. I chose Dr. Mehta. I said, I'm far more reassured, I'm far more comfortable, and I felt that I was in completely safe hands. And the operation was actually, I went 2 days ago to meet him again. It's been over a year since the operation. My eyes are absolutely okay. And I have full faith and full belief because he just made it easy and he made it reassuring.
This hospital is updated with the latest ophthalmological technology. Our latest world-class laser studio incorporates the Visu Max laser system to perform bladeless LASIK and the third generation laser vision correction procedure called SMILE, which is a bladeless and flapless surgery.
Patients also ask me, when anyway a flap is going to be made, why go in for femto-LASIK procedure over the conventional blade procedure? Well, the blade laser procedure has helped us and it has worked very well for the last 2 decades. But now you have a better, more dependable, more safer technology. So why wouldn't you go for it? We all have used the box television for 20 years. It served us well, but all of us have flat screen TV, all of us have high definition TV. So today's technology is the femto-laser technology because it is far safer, far dependable than your existing blade technology. So if you want the best for your eye, that is what you have to go in for.
The laser studio is also equipped with the Lens X femtosecond laser to perform laser cataract surgery.
This is the femtosecond laser cataract surgery system. It is the most recent advance in cataract surgery. It is a very unique technology It captures high resolution optical coherence tomography guided images of the eye, and based upon the individual eye measurements, the density of the cataract, it creates a program which is suited for that particular eye.
I was not able to see, I had my specs and I could not see too far. And last month I approached for LASIK because I was tired of wearing those glasses. I've done my LASIK in both my eyes. It's a painless procedure. Completely. My entire family is visiting Dr. Mehta. They care a lot for you. I mean, whenever you need anything, they're always there for you.
The Department of Pediatric Ophthalmology and Squint is headed by Dr. Deepak Garg.
I'm a pediatric ophthalmologist and a squint specialist at the Infiniti Eye Hospital. The commoner problems that we could see would be allergies, infections, and of course, children needing to wear glasses. The not so common problems, which are very serious, could be cataract and of course injuries that children may have. As a squint specialist, we examine and treat patients of all age groups who have squints. These squints can be of various kinds, and depending upon the type of squint that we see, the treatment varies. Most, not all squints are treated by surgery. Some squints, however, can be corrected by giving glasses. The key aspect in treatment of squints is to examine the patients correctly in the clinic and only then perform the surgery. Overall, in today's time, we find that the results of squint surgery are very gratifying.
Hi, my name is Dr. Rupali Sinha. I'm a trained orbit and oculoplastic consultant. Orbit and oculoplasty deals with diseases of the eyelid, the orbit, trauma around the eye and the bones, cosmetic eyelid problems, and the drainage passage of the eye. We deal with drooping eyelids, inward and outward turning of the eyelids, eye cancers, eyelid cancers. We deal with cosmetic problems like eyelid bags. We deal with a watering eye and do surgeries like dacrocystorhinostomy and dacrocystectomy.
Importantly, we are equipped with 2 state-of-the-art, bacteria-free, constant laminar airflow modular operation theatres. The airflow is at positive pressure, filtered by 0.3 micron HEPA filters to provide 99.9% dust and bacteria-free air around the operating table. All of this combined with theatre walls made of seamless and jointless GI steel puff panels and anti-static, antibacterial and antifungal Gairflow vinyl provides a highly contained atmosphere, all towards reaching the greatest care in the most efficient manner.
I'm Dr. Sushil Chauhan. I'm the anesthetist at Infiniti Eye Hospital. From anesthesia perspective, patients who are undergoing surgeries, they first go for pre-anesthetist checkup. Then the plan includes pre-anesthetist checkup. During operation, they are monitored, and post-operative care. For cataract surgeries, we put drops in the eye, that is topical anesthesia for most of the patients, in which the surface of the eyeball is made numb and the patient undergoes surgeries comfortably. There is local anesthesia in which we give anesthetic agent around the eyeball. Some patients require local anesthesia with IV sedation. At Infiniti Eye Hospital, we have state-of-art workstation from Drager, which is very safe, and we always advise patients to discuss about anesthesia before they undergo procedure.
We prepare our patients for surgery with pre-surgery counseling and post-surgery care. Competence and efficiency is of little use without an absolute compassion for the patient, which is why compassion must be delivered as effectively as the treatment. We have 6 recovery rooms for post-surgery recovery. We also provide services of an eyeglass and contact lens clinic, along with low visual aids and visual prosthetic support. We test vision. We improve it. We strive ceaselessly to add to it. Ours is a noble mandate. As technology evolves, our task is to perform near perfect, consistent, and reproducible surgeries to improve your vision. We are the Infiniti Eye Hospital. With our excellent doctors and our superb staff, our task is to bring you the best possible care in healing your vision, and do so in kindness, in compassion, and with the greatest possible expertise. We are the Infiniti Eye Hospital.